This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. The needs of autistic youth can vary. As a spectrum disorder, some diagnosed with high-functioning autism can live relatively normal lives, pursuing college, careers, and relationships. But others require more support. Those with intellectual disabilities and communication challenges often require lifelong support to help with tasks of daily living. Some engage in self-injury and other aggressive behaviors, which could lead to the need for around-the-clock support. And these resources can be limited depending on where you live and can be expensive. One school that claims to offer this level of care is Shrub Oak International, a residential school in Westchester County, New York, serving students across the country, including right here in Connecticut. But a recent investigation by ProPublica's showed that this institution that costs nearly $600,000 a year is failing its students. This investigation uncovered several accusations of neglect and abuse. We'll be diving into that reporting today, and later this hour, we'll also learn how some doctors are thinking about the specific healthcare needs of neurodivergent communities. But first, let's hear from the ProPublica reporters who led the investigations into Shrub Oak International. Joining us now are Jennifer Smith-Richards and Jodi Cohen. Thank you so much, Jennifer and Jodi, for joining us today.
Thank you for having us on.
Glad to be here.
And for our listeners, you can also join the conversation, 888-720-9677, or leave us a comment on Facebook and Twitter at Where We Live. So, Jennifer, I want to start with you. Before we get into the details of the investigation, can you give us an idea of some background on this school, how it came to open and operate?
Sure. It's a relatively new school. It opened in 2018, as you mentioned, in Westchester County, New York. It opened on the campus of a former seminary. It opened and its mission was to serve students who were perhaps diploma bound, perhaps college bound, but it quickly shifted to serve a greater need of students who had some pretty complex behavioral needs and some pretty complex medical needs. The school serves about 85 students this past year, and they come from all over the country, 13 states and Puerto Rico, as you mentioned, including Connecticut. So the school really caters to students that have really high support needs, and most of the students live there year-round.
And Jodi, this is a private institution, so who provides oversight to this school?
You're right. It's a private for-profit institution, and part of our investigation found that there really is a lack of oversight. The school operates in New York. It got approval to operate a business from the state, but it did not seek or get approval to operate a school for students with disabilities. So in New York, that means it does not get oversight from places like the Justice Center, which is an organization that would look into concerns related to people with disabilities, or other organizations or agencies in New York. And also we found there are, as Jennifer mentioned, there are students from about 13 states who were there this year. The school districts where those students are coming from are responsible for those students, but we found that there was often a lack of oversight or monitoring by the school districts that were sending the students there.
And so, Jennifer, with this lack of oversight or monitoring, how do children end up getting placed there?
There are a variety of ways. I mean, sometimes parents have found Shrub Oak and opt to send and pay out of pocket. So that's one way. Another way is that parents may find Shrub Oak and urge their school districts to place the students there, and they may, end up taking a legal route and actually suing the school district for placement. And in some cases, the school districts themselves have, found and accepted Shrub Oak as an appropriate placement for the student.
One thing that's important to keep in mind is that most of the students who are at Shrub Oak are paid their tuition, $500,000 plus tuition is paid through public money. So the school districts are, and the states where the students are coming from, are paying those tuition bills in most cases.
And I wonder if this is a question for Jennifer, but Jodi, please feel free to jump in if it makes sense. Is for parents to make these decisions. This must be a challenging decision to make for them.
Yes, I mean, one parent after parent told us, look, nobody wants their child to live in a residential setting all the time. It's often an excruciating decision to place your student, sometimes, thousands of miles away from their home. So it is a very difficult decision. And often when parents have come to Shrub Oak, they have tried to find another place for their child and been unsuccessful. So the child may have been in a previous residential placement that didn't work out. It may be that places really felt like they didn't have the capability to support the level of need that the student has. So we heard over and over again from parents that Shrub Oak often is the only place that says it can care for their child.
And so what about Shrub Oak that caught your attention? So tell us a little bit about the onus of this investigation. How did you all come across this?
So Jennifer and I are based in Illinois, and it first got on our radar because Illinois passed a law a couple years ago that allowed public money to more easily go to students who were at unapproved schools out of state. And that we just sort of decided to watch that and see what happened. There were people who reached out to us with concerns about what would happen to students going to unregulated schools. And then we started hearing some specific concerns about Shrub Oak, and we looked at the data, we looked at records. We realized that Shrub Oak was the school that more students were going to from Illinois than any other unapproved school. And Illinois is actually the biggest sender of students outside of New York. So that's what really got us interested in Shrub Oak. And then the more we requested records and talked to people, we expanded this to really look at it from a wider lens than just Illinois.
Right. And then because this was already on your radar to some extent, and especially with the various students coming in from 13 states and all the different backgrounds, but you did end up uncovering several incidences of abuse and neglect. So can you sort of walk us through the process, Jodi? What did you find and how did you uncover this?
So our reporting involved public records requests to school districts, really around the country and to states around the country. And we also talked with, in the end, nearly 30 families of whose children had gone or were still at Shrub Oak, many, many workers there. And what we found was that, and we got police records too, there were just times when there were, unexplained injuries on students, unexplained black eyes, that there's a health staff there and there would be medication mix-ups, that there weren't enough staff, that students who were supposed to, have a dedicated aide, that was not always happening, that there were not enough workers there to serve the number of students who were there. And we found that when there were concerns, that people would turn to different agencies in New York to try to get help, and were repeatedly told, they're not under our jurisdiction, we can't help you.
Well, I think that echoes the difficulties that parents have making those decisions in the first place to place their kids at this school, only to be told that. And I believe earlier we mentioned that there's about 85 students that have been placed, and you spoke with about 30 families. Can you talk about what were those conversations like?
So that was 85 students this past school year, not over the lifetime of the school. The school's been open since about 2018. But the conversations often, they were very similar. So they would start with that they found Shrub Oak at a time of desperation, as we talked about, that their child was very challenging behaviors, was not safe to be at home, and that there were Shrub Oak was like their last option, that there was the school that would take them. and that they had these very high hopes and lots of promises that the school said it would provide individualized plans, individualized attention, that the amenities were going to be amazing. There was going to be this, amazing kitchen and beautiful dorms and indoor therapy pool. Some of these things have never materialized. And then their student was there and had some success. That people did talk about some successes on the education side in particular, but that they then realized they had all kinds of concerns that we talked about.
Right. And Jennifer, with many of the children being nonverbal or they don't have the ability to really convey their emotions and how they feel, can you talk about how did parents uncover that this was happening?
In some cases, parents would go to visit their children and would look at their bodies and see that that they had bruises, um, things that had not been conveyed to them by the staff, and there really was no explanation for. In some cases, the school itself disclosed that something had happened, that maybe there was a medication mix-up, or a student hadn't received their medication for some period of time. In some cases, there was police involvement, right? So
Right.
something significant enough had happened that the school had called police. And in many cases, the workers themselves who were at the school told parents, hey, we think there's a problem. We're noticing this about your child and we're concerned. So people were raising the alarm in many cases to parents directly and saying, I know that your student isn't going to tell you that this happened, but we're worried about the student's welfare.
And I know based on your reporting, there's documentation of physical abuse and neglect. Did you also uncover reports of emotional and mental abuse as well?
We did have parents explain to us that they felt that their children were being generally mistreated. A lot of the things that we heard from parents were about students being left in their bedrooms for long periods of time, not being required to go to class, being left in filthy conditions. There were reports of kind of urine-soaked mattresses and unsanitary conditions. So we did hear from parents a number of concerns that ranged from neglect to various types of abuse, not just physical, as you point out.
Right. Based on your reporting, Jodi and Jennifer, whoever wants to jump on this one, there were families who did feel that Shrub Oak was the right place for their kids and that their kids were helped by the school. So can you give us an idea of what that looks like for them?
Yes, so Shrub Oak, we talked to 4 families who Shrub Oak directed us to speak with, and as well as other families who said that Shrub Oak really has been a godsend for their children, that they were safe there, that their needs were being met. They understand that there are other families and other students who have not had that experience, but for them, it's been, what has worked for their family. And they say that they would be lost without the school.
And Jennifer, after the report came out, how did the school respond to your reporting? And do you know what the status of the school is right now? Is it still active?
It is still active. It is still accepting students. Um, so the school responded, very, very strongly to our reporting. They deny that there is abuse happening at the school, and they really reinforce the good experiences that some parents have expressed that they're having, and the successes that their children are having. They published a statement that is attempting to rebut our findings, and they have said that they are going to seek approval to operate a special education school in the state of New York. That has not, as far as our reporting has shown, that has not happened yet. They have not actually sought that approval, but they have indicated to a number of people and to us that they do plan to seek that that level of oversight.
And just a quick note to our listeners that we have reached out to Shrub Oak International for comment, and as of this hour, they have not responded. You've been listening to Jennifer Smith Richards and Jodi Cohen from ProPublica. And coming up, they'll be staying with us, and we will be hearing from the Connecticut office of the Child Advocate. And for our listeners, you can also join the conversation. Let us know if you have any questions. 888-720-9677. That's 888-720-WNPR, or find us on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. Today, we're hearing about an investigation into Shrub Oak International. It's a residential school for autistic children and young adults. After a ProPublica investigation uncovered reports of abuse and neglect, officials across the country, including here in Connecticut, have warned against sending students to this school. Unfortunately, many schools that have claimed to serve the needs of disabled youth have come under similar investigation, including High Road schools in Hartford, Bridgeport, Waterbury, and Stratford. Joining us now is Sarah Eagan, and she's the Connecticut Child Advocate. Thank you so much, Sarah, for being with us today.
Good morning. Thanks for having me.
And also still with us is Jennifer Smith Richards and Jodi Cohen, who are both reporters for ProPublica. So I want to jump straight to the conversation, Sarah. You've been listening to Jodi and Jennifer's reporting earlier. Can you respond to what you've heard? Anything jumped out to you or surprised you?
Well, I wish that I could say that things surprised me, right? But they don't. And I think that Jennifer and Jodi's story, and thank God for journalists and thank God for investigative journalism, because boy, we need it so bad. And these kids need it, and their families need it, because what the story reminds us, like other stories that we've heard and been reported on, is that children with disabilities, vulnerable children, and their families, they need services close to home. They need the right services and supports. And when their child does need, or a child needs 24/7 support, which some children may for a period of time, boy, monitoring, oversight, inspection, rigorously and reliably and transparently done is a must to ensure the basic minimum of safety and quality. Otherwise, it's just a staggering risk for kids. And this reporting is yet another cautionary tale.
And do you know if Connecticut students are still being sent to Shrub Oak?
Well, I can tell you that right now, the Office of the Child Advocate and Disability Rights Connecticut are jointly investigating the placement, and as Jodi and Jennifer pointed out, the public subsidy that is used to place and maintain children in Shrub Oak and other similarly situated programs, other programs that Connecticut children are sent to that may be unlicensed or unregulated. I can tell you, and as has been reported, that the State Department of Education has reached out to the Connecticut districts that have contracted with Shrub Oak to caution them about the reported concerns and preliminary concerns from Disability Rights Connecticut, has also publicly reported. But I can't sit here today and tell you that the state of Connecticut has prohibited the ongoing placement of a child at this facility, or that the state of Connecticut has said districts can't place a child going forward, or that the state of Connecticut has said you can't place a child in an unregulated, unlicensed program, or that the state of Connecticut has said prior to any placement of a child in an out-of-state facility, you need state approval, which is actually required by state law.
Right. And we heard earlier from Jodi, how much this school costs. For most of the students, it's over $500,000 a year. So can you help us understand better, how is this being paid for? And especially since some of these students do have these tuition costs subsidized.
Right. Well, it's as was reported, and certainly what we see in our experience and in our reviews, is that it's public money, right? And consider this. Children and families desperate for supports and services that are not available in their local school district or in their local community, right? Because it's really about both. It's the lack of access to care in the community and the lack of access to appropriate services in the school district that propel these types of desperate moves for kids and families, right? So we can't access the care in the community because of, you name it, workforce, lack of resources, lack of investment. And what that leads to, paradoxically and counterintuitively, is, you know, a $500,000 a year placement of a child in a program that nobody knows what's going on, right? And that happens for the children at Shrub Oak. It happens for children all across the state of Connecticut. You know, at any given time, there are likely hundreds of children in the state of Connecticut placed in out-of-state settings. They're not all, we can't paint them all with one brush. Certainly, there are programs where children, families, and school districts are satisfied or more than satisfied with the services that they're getting. But is largely paid for with public dollars. It is a lot of public dollars. It is a loosely, at best, regulated and overseen industry and set of placements. And it is spending dollars that, frankly, should be spent more economically, more efficiently, and more effectively in people's communities, right? As Jodi and Jennifer said, parents don't want this choice. Nobody wants this. So what it's really telling us is that this is a staggering failure of public policy, which should be focused on meeting the needs of children and families in their communities, keeping children in the least restrictive environment, because look what happens when we don't.
Well, and then we also find ourselves in a case in a more local setting where families, some families thought they were able to find that service and programs for their kids, but also finding themselves in a similar situation with Shrub Oak. And so we want to get an update on this. And the last time you were on, we talked about High Road School, and now the Office of the Child Advocate recently filed a complaint with the Department of Justice against High Road School. So can you remind our listeners, Sarah, you know, what is High Road School and what led to that investigation in particular?
Yes, thank you. So that was another joint investigation the Office of the Child Advocate did with. So over the years, we have heard concerns from family members, educational advocates for kids, educational surrogates, the professionals appointed by the State Department of Education to advocate for the educational needs of children in foster care about High Road schools. So a few years back, we entered into an agreement with Disability Rights Connecticut to look at conditions and educational services for kids in this program, which is a state-approved, publicly funded, private special education program operating in the state. It's actually one of the state's largest and served probably 300 plus kids a year. High Road is owned by a corporation, which is owned by a private equity firm, American Securities Inc., and it is a for-profit entity that purports to deliver special education services to children pursuant to contracts with school districts. But Catherine, what we're also looking at, and in fact, I would say primarily is not only what do kids get there, but how do local school districts and the State Department of Education monitor that? A, because they should, B, because they're legally required under federal special education law, and C, because the LEAs have contracts, sometimes in the millions, for this program to educate their students. And what we found over the course of a multi-year review were serious irregularities, widespread non-compliance with what I would call the bare minimum of state statutory and regulatory requirements around the use of credentialed and background check staff. And we used two highly credentialed educational experts from the state, working in the state, to review 30 educational records, and those reviews found serious deficiencies in the provision of adequate and individualized special education services to children. We found widespread use of restraint and seclusion with children as young as elementary school, practices that are widely condemned as being traumatic, prone to injury for children and staff, and ineffective for students. And what we also found, Catherine, is minimal oversight by many of the contracting school districts and inadequate oversight from the state to ensure that those irregularities and those problems did not occur, right? And at the end, the people who suffer from that are kids and their families who are looking for and promised solutions. So you're right that resulted in our recent joint filing of a complaint with the Department of Justice, naming 4 school districts that contract with High Road that are larger consumers of High Road services, Hartford Public Schools being the largest, right? And while we are not unsympathetic to the challenges of school districts that are struggling to meet the extensive needs of their students in their community, our constituency are not the school districts. Right. Our constituency are the kids and families.
Well, and with your description, you mentioned, I think this is a little jarring, and we're talking about a classroom space, but you mentioned restraint and seclusion. So can you tell us about these tactics and why is that important to point out?
Restraint is the use of force to change or address a child's needs. Seclusion is the use of forced isolation to manage a child, often a young child's behavior, right? These are not effective strategies to support children with disabilities. As researchers have shown for decades, examining restraint and seclusion in all kinds of settings for people with disabilities. Restraint and seclusion are the result of treatment failure. So a program that is recounting hundreds and hundreds of restraints of force and isolation of young children with disabilities is by definition harming them and not meeting their needs. There is some belief out there that somehow these kids need that. It's inevitable with these kids. But time after time after time, effective programs working with people who have complex needs have disproven that and shown that you don't need to put your hands on kids. You don't need to isolate kids. You don't need to scare kids. You don't need to traumatize kids to meet their needs, nor should we be doing. So yes, that's a very serious concern and was in fact at the heart of our complaint with the Justice Department. These children deserve and are entitled to better.
And Jodi and Jennifer, I want to end this part of the conversation by hearing from you. You've been listening to what Sarah has to say, and you shared your reporting earlier too. Can you talk about, maybe we'll start with Jodi first. What do these cases tell us about a greater need to serve children with disabilities and support for their families? Because unfortunately, what we're hearing today, it's mostly not new.
I think it's what Sarah was saying earlier is that parents and families are looking for they don't want to send their children away. They want options where they can stay close to home. They want there to be accountability at places. They want there to be oversight, and they want to make sure that there's someone watching out for the most vulnerable people, which is who the young people who are going to residential places.
Jennifer, anything you want to add to that?
Well, I think one thing that actually Sarah told us as part of our reporting is that people deserve high quality services. They deserve places that are going to meet the needs of students with disabilities, and I think just in the interest of people with disabilities and vulnerable populations, we should have oversight. And as Jodi pointed out, parents believe that too, and that's what they're looking for.
Right. And we've covered a lot of ground in this short conversation. But Sarah, I would love to ask you some final thoughts. What do you hope our listeners take away from our conversation today?
What I keep thinking about, Catherine, is these children are human beings. Their families are real people in our community. We should be long past the time where we need to send children away or force families to feel like this is their only option, right? And families and children need and deserve services in their community. That is the call to action, and that is a call we can and must answer. I know we can do it. We have to do better.
Well, thank you so much for that. You've been listening to Sarah Eagan, who's the Connecticut Child Advocate. Thank you so much, Sarah, for joining us today.
Thank you so much for this important topic.
And you were also listening to Jennifer Smith-Richards and Jodi Cohen, who are both reporters for ProPublica. Thank you so much, Jennifer and Jodi, for joining us on Where We Live today.
Thank you.
Thanks.
And coming up next, getting adequate and equitable care can be a challenge for autistic youth and adults alike. We'll hear from one physician on the autism spectrum. She'll respond to this investigation and talk about how autistics are advocating for themselves in care facilities of all kinds. You can join the conversation, 888-720-9677. That's 888-720-WNPR, or find us on Facebook and Twitter at Where We Live. This is Where We Live from Connecticut Public Radio. I'm Catherine Shen. Healthcare systems can be tricky to navigate, and this can be even more so for the neurodiverse community. Dr. Mary Daugherty is the founder of Autistic Doctors International, an information and peer support group for doctors on the autistic spectrum, and she is an attending anesthesiologist and clinical associate professor at the University College in Dublin. And she joins us now. Thank you so much, Dr. Daugherty, for being with us today.
Thank you. Good morning.
And for our listeners, let us know if you have any questions. You can also join the conversation, 888-720-9677, or leave us a comment on Facebook and Twitter at Where We Live. So, Dr. Daugherty, you've been listening to this conversation about the investigation. Can you respond to anything that jumped out to you? It seemed to really show the vulnerabilities of the population of high-need autistics.
Yeah, absolutely. I mean, as an autistic woman, as a parent of an autistic teenager, this breaks my heart. It breaks my heart to hear that the same sort of issues happen internationally. There are stories after stories, scandal after scandal of educational settings, residential mental health settings where autistic people are just not understood and traumatized and abused. And the outcomes are so horrific. And it doesn't have to be like that. There's some similar issues in education and in healthcare, difficulty accessing services, difficulty being understood. It doesn't have to be that way. Sarah mentioned it being a staggering failure of public policy. It's also a staggering failure of education and training of staff that are looking after autistic people with complex needs.
Well, and you're speaking to us across the pond today, but mentioning that this is something that unfortunately is universal. Does it look different there? Does it look similar? What does it look like?
It's the same. It's very, very similar. I mean, there have been so many instances, so many wonderful journalists and reporters who have even gone undercover into residential settings to shine a light on the abuses that are happening. And we have to find better solutions to the current situation.
And I think in recent years, we're hearing more and more, I think getting more exposure of people on the spectrum having, started working to advocate for themselves and to get proper support and care that they need. But for those with more high support needs, what does self-advocacy look like there?
That can be very, very difficult, and particularly for autistic people with co-occurring intellectual disabilities, with high support needs, who may be potentially, minimally speaking or don't use words at all. It can be really difficult, but I think prioritizing communication at a young age can have a dramatic impact. People can communicate. We need to move away from the focus on speech, on verbal communication. But certainly when people haven't been able to develop that, involving families is just so important in terms of advocating for their loved ones' needs, but also including the autistic community, autistic adults, autistic researchers, autistic professionals. Because the thing is, people often tend to think of autistic people as two separate groups with very different level of needs. But I think it's much more beneficial to focus on what we all share. The sort of experiences in the world that we do share, whether that's sensory environments, whether it's the need for predictability, it's the way we communicate. There's a lot that we share. We might not all have high support needs all the time, but even articulate autistic professionals will have very high support needs intermittently. And I think looking at that systematically, I think can offer an insight into the experiences of autistic people who are not able to explain their, their internal experiences. And we have a lot to be grateful to autistic researchers, I think, who have, described their own experiences and have researched this amongst the autistic community. So, we know about things like autistic burnout, we know about autistic inertia, we know about the sensory issues that we all experience because of autistic researchers who have looked at that.
Well, and you talk about the sharing, and I would love for you to expand on that, especially when we're talking about communication when someone is nonverbal. Can you talk about how does that get developed and how can we listen better?
I think there's very much a focus on speech therapy, for example, and developing speech with young children. Whereas what's much more important is to focus on sharing communication that doesn't necessarily involve words. And moving to potentially picture-based communication or text-based communication. And the thing about autistic people is even as adults, we will often find text-based communication much easier than verbal communication. I'll commonly interact with my son over text. We don't bother using words sometimes. It's just that takes too much energy. But being able to recognize that and prioritize communication over speech, I think we will benefit a lot of autistic kids, a lot of autistic families, because a lot of what's termed challenging behavior, I prefer the term distress behavior. A lot of that is because autistic kids can't get their needs, can't express their needs and don't get their needs met. And then, of course, if people looking after them, particularly in educational settings or indeed in healthcare settings, don't understand what autistic needs are, don't understand how we experience the environment differently to non-autistic people, for example, how will process emotions differently, and then say an autistic person might start to become distressed, and inadvertently that situation is escalated by somebody coming in too close, crowding the autistic person, even touching the autistic person, which is the worst thing that you can do. And then you think about training for educational providers, and often the first thing they're taught is that restraint and seclusion training before they ever learn anything about what it means to be autistic. And I think we need to reverse that.
Well, and we mentioned at the top of the hour too that healthcare systems can be tricky to navigate anyway in general. Can you talk about if there are added challenges when autistic youth are transitioning from pediatric care to adult care practice?
Yeah, absolutely. That's a really tricky transition because autistic kids, all young adults are expected to be able to advocate for themselves within healthcare, and not rely on a parent as they do, under 18. But the difficulty is that that's much, much harder for autistic kids, autistic adolescents. Commonly, autistic adolescents develop maybe on a different trajectory and may find it much harder to advocate for themselves, much harder to communicate independently, and perhaps for longer than non-autistic kids might do. But even for autistic adults, accessing and navigating healthcare is incredibly difficult. Now, especially, given the pandemic that we've all lived through, healthcare is really difficult for everybody, those accessing the services and those working in the services. But there are specific challenges for autistic people, and it's even the simplest things like reliance on the use of the telephone to make appointments. That in research that we've done, that was the single most common barrier that autistic people faced in terms of accessing healthcare, just not using the telephone, not being able to use the telephone. The sensory environments in most healthcare settings are just so difficult. The lights, the noise, the smells, the crowds, other people. And the thing is, while that might be unpleasant for other people, for non-autistic people, it acts as an absolute barrier to autistic people sometimes, particularly when, already sick, and
Right.
the anxiety of an unpredictable healthcare environment is really difficult for autistic people. And the thing is, we face a mortality gap. We have shorter lives than non-autistic people do. And autistic people with complex needs, that's exaggerated, that's even greater. But so much of that is due to difficulty actually accessing healthcare. So I think it's really important. And there's similar issues in education and in healthcare. So much of it is down to training, and to the lack of training that professionals get around autism. I had no training on autism throughout my medical education. And it's the same for those in education, for teachers. There's very little, certainly there's very little provided by autistic people. So we're trying to do that in Autistic Doctors International. We're trying to, develop, we research and we write and we publish and we train our medical colleagues. But it's quite difficult. Particularly because it's hard to disclose. And that same issue happens in education as well. So there is a community of autistic teachers who have huge amounts of expertise to offer in this area. And yet, because of cultural issues, it's very, very difficult to even disclose. So all that knowledge is hidden. And I think if there was anything I could change, it would be to change the culture, to just facilitate disclosure, to have a situation where autistic professionals, both in healthcare and education, would enjoy parity of esteem with their non-autistic colleagues, but that's not yet the case.
Well, I think this is a big question that requires a big answer. So maybe we can break this down a little bit. But because based on what you're saying, there are still so many challenges, and I think part of the answer will be more training for us to do better, and need more resources for physicians to do better. But can you talk about also maybe the discrimination that autistic people may face, like ableism and all that, and what resources are necessary, or is training the answer to sort of bridge those gaps and to stop the discrimination?
Yeah, I think training and visibility of, particularly, I think, senior, successful autistic physicians, autistic teachers, autistic professionals across all fields. I think that is absolutely needed. The other thing that's needed is we need to get autistic youth into these professions. We need to stop seeing we need to see the potential in autistic people, because I think if we have autistic people providing educational services, providing healthcare services for autistic people with maybe more complex support needs, that will absolutely improve services for everybody. So I think training is very, very important. But medicine in particular is such an ableist profession. There's data to show that the vast majority of physicians feel that, a disabled life is less than a non-disabled life, without ever asking disabled people. And I think we really need to challenge that culture in medicine, so that we move towards that parity of esteem, and that culture where it's safe to disclose. Because the accommodations that benefit autistic people make the environment better for everybody.
Well, and you mentioned bringing in more visibility, which also includes, encouraging or creating safe spaces for more autistic youth to be out, or to be visible. Is that something that you're seeing, or something that you're doing to help encourage them to be visible?
Yeah, absolutely. I think so. And I think it's wonderful that, younger autistic people are growing up with that sort of sense of confidence. And we've moved away, or we are moving away from that traditional core deficit pathology perspective on autism towards a neurodiversity affirmative approach. And we can see the benefit in the generation of autistic youth who have grown up with that. I see it in my own son. He's confidently autistic in a way that those of us who are identified in adulthood just didn't have a chance to be. And I think that is the key. The next generation of autistic kids can grow up to have much better outcomes than currently, and then can potentially be part of the solution in terms of providing support for those who have more higher support needs, more complex needs. That's what I'd love to see happen. But I'd also love to see, career guidance teachers thinking about, guiding autistic students into the caring professions. Because actually, healthcare and education are two of the bigger, two of the fields that autistic people do tend to gravitate towards, and potentially in contrast to the stereotypes. But we need to, I think we need to make this a much more visible career option. And therefore, of course, we need to put in accommodations for students going through those courses. So we have developed a framework. It was aimed at healthcare. It's the Autistic Space Framework, and it was aimed at meeting autistic people's healthcare needs, but it's equally applicable to education and to other settings as well. And it really focuses on the core needs of autistic people, regardless of support needs. And the framework, the acronym stands for sensory needs, predictability, acceptance, communication, and empathy. And we also talk about physical space, processing space, and emotional space. And that's the sort of thing that schools, that educators, that healthcare professionals can just take on board and just use that to learn about autism and learn to meet the needs of their autistic pupils or patients.
So I believe the acronym is SPACE. And so we got about a minute and a half here left, but I do want to ask, if people want more resources and whatnots for themselves or for a loved one, where would you direct them?
Have a look at our website, Autistic Doctors International. There's a link there to all of our resources, all of our publications. You can also look at Linktree as well. And the Autistic Space Framework, we published it in the British Journal of Hospital Medicine, and it's open access. It's free to use. You can download this. You can print it out as a poster. You can put it up on your wall. You can use it however you want to use it. I would ask, if you're going to use it, please let us know. Please evaluate it, because we need to build the evidence base for this framework. But I'm hoping that this framework will become the dominant model for meeting the needs of autistic people in healthcare settings and also in educational settings.
We got about 30 seconds, and we'd love to get some final thoughts from you, Doctor. What would you like our listeners to get from this conversation today?
That we need to move away from tragedy narrative, core deficit framing of autism. We need to move to a neuroaffirmative approach, because regardless of support needs, that will maximize the outcome. That will maximize the mental health of autistic people. So that's the most important thing, a neuroaffirmative approach to autism. The world needs us.
Well, thank you so much for sharing your work and your thoughts and your experience with us, Dr. Daugherty. You've been listening to Dr. Mary Daugherty, who is the founder of Autistic Doctors International, which is an information and peer support group for doctors on the autistic spectrum. Thank you so much for being with us today. I'm Catherine Shen. Today's show is produced by Tess Terrible. Our technical producer is Jean Amatruda. Download Where We Live anytime on your favorite podcast app. And thank you so much for listening.